we go, myths versus facts, testicular cancer. Here we go. Here's the statement. I'll say the statement, and then Dr. Kiriluk, you'll say myth or fact, and you'll tell me why, and we'll kind of keep this going. I'll jump in every now and then. Here we go. Here we go. Statement. Testicular cancer is always deadly. Myth or fact?
That's absolutely a myth, as we talked about before.
All right, excellent. I agree with you. That's a myth. The survival rate is very high on testicular cancer, and almost at any kind of presentation of the disease, you're going to have a very, very, very high chance of having a great 5-year survival. Testicular cancer is one of the most curable cancers out there. It's been a really successful. Here we go. Next statement, Dr. Kiriluk. There is currently no screening tests to detect testicular cancer. Myth or fact?
By the definition of a screening test, that is true. You know, screening tests are tests we use across the population to identify a disease before someone has a symptom. And so we don't recommend routine ultrasounds or routine lab work to look for cancer in an otherwise healthy individual, which is why we rely on physical exam findings and the importance of someone doing self-exams or having a physician do an exam.
Wonderful. Here we go. I like this one. This one's for you. Injuring your testicles increases your risk of testicular cancer.
No, that's a myth.
So the whole riding a horse repetitively, horseback riding, riding on your bicycle for doing all stuff, that's all myth?
That's a myth.
All right. Thank you for the clarification. Yeah, that's one of the biggest ones out there that I even get some questions that are asked and when I do some of these exams, and people just kind of shoot the stuff and say, hey, can you get this from this? I'm like, no, but I'm glad I checked with you because I don't want to have egg on my face when I see my patients. Here we go. Here's the next thing. Here's a statement. Surgery for testicular cancer can cause it to spread to other parts of the body. Myth or fact?
And that's a myth, and that kind of talks about what we mentioned before about why we do surgery and the way we do it, and that's to, in a controlled way to prevent spread from happening. So not something that we worry about.
Wonderful. Here we go. I'll take this one. I'm giving this is the easy one. I got this one. You'll like this one. Here we go. People only get testicular cancer if there is a family history of the disease. That is a myth. We just talked about it. That the overall majority of men that present with testicular cancer have no family history. Although if there is a family history, your father or your brother, for example, certainly we want to learn more about that. But again, the overall majority of people that present with testicular cancer do not have a family history. Here we go. Dr. Kiriluk, I like this statement. Here we go. Infertility can not only be an issue in men with testicular cancer, but also later in life for boys that have had testicular cancer. Myth or fact?
It can be an issue, so that is true, that it can be, but again, ways that we can manage it, and typically speaking, it is not an issue.
Wonderful. Here we go. I think I'll give you this one. Here you go. This is a good one. Having a cell phone in your pocket increases your risk of testicular cancer. Myth or fact, Dr. Kiriluk?
That would be a myth.
Yeah, I'd see this. 5G will not do that. And it's interesting. It's interesting. I was breaking it down on recent COVID, my recent COVID show that 5G in and of itself does not transmit COVID, and that's somebody's going around with that. But the reality is that the energy from your cell phone, energy even from 5G, is not strong enough to denature cells and break things down. So it's actually even weaker in the electromagnetic spectrum than visible light. So there we go.
Absolutely.
Here we go. I like this one. Dr. Kiriluk, here we go. Here's a statement. We'll do a couple more of these. This is fun. Testicular cancer only affects younger men. Myth or fact?
Well, that's false. It tends to, or it's more common in younger men, and it's the most common solid tumor in men, from 20 to 35. But absolutely, I've had patients 50s, 60s, 70s who've been found to have testicular cancer. So it can affect men of all ages.
Wonderful. Thank you for breaking that down. I'll take this one. We'll do a couple more of these. Here we go. This is more of a broad statement, but clinical trials are for patients at any stage in their diagnosis of cancer. And I will say that's a fact. we want people out there, if you're working with your oncologist and you have that diagnosis of cancer, there may be therapies that are out there for you. Of course, only your medical oncologist will know all the studies that are out there, all the therapies, but sometimes that may involve a clinical trial. The great thing is, as Dr. Kiriluk mentioned earlier, with testicular cancer, a lot of times we're not going down those pathways of high-dose chemotherapy and things like that in those patients because they're really addressed much earlier along the process. All right, here's a statement, a couple more. Dr. Kiriluk, here we go. Losing one testicle usually has no effect on a man's ability to get an erection and have sex. Myth or fact?
That is a fact.
Please explain.
The other testicle has, makes testosterone and makes sperm, and even in someone who has chemotherapy, the cells that make testosterone are very robust and tend not to be impacted by chemotherapy to a great degree. We monitor testosterone in some cases, but not something that is a usual thing to worry about.
Wonderful. And I'll take this last one. Here's a statement. Again, I got all the easy ones. Dr. Kiriluk, there you go. No matter how extensive the diagnosis no matter how extensive the disease at diagnosis, the possibility of testicular cancer cure exists. That's an absolute fact. We've talked about it, that these individuals, once they get that diagnosis, if they were to get the diagnosis, they have a very, very high cure rate. So that is an absolute fact. So we got about 5 minutes left.